try to understand about hypertensive crisis. It is divided into two types. The first one is hypertensive emergency. The second one is hypertensive urgency. The basic cutoff of the hypertensive crisis is when the systolic is higher than the 180 mmHg and the diastolic is higher than the 120 mmHg. On the basis of the end organ damage, we can classify whether the patient has hypertensive emergency or hypertensive urgency. If there is end organ damage, it is said to be as hypertensive emergency. If not, then it is said to be as hypertensive urgency. Now, what are these end organ damage? Include hypertensive encephalopathy, acute stroke, intracranial hemorrhage, acute coronary syndrome, pulmonary edema, aortic dissection, acute or rapidly progressing renal failure, sympathetic crisis. Now, how can we treat this hypertensive crisis? On the basis of the condition, if the person is having hypertensive urgency, we can use certain oral drugs such as ACE inhibitor, beta blocker, alpha blocker, calcium channel blocker, diuretics. And in a hypertensive emergency, we can use certain parenteral drugs such as nitroglycerin, nitroprusside, labetalol, nicardipine, and also avoid decreasing the BP less than 25% in first 2 hours. The goal is gradually decrease diastolic BP to 100 to 105 mmHg over 6 hours.